Hi Lee. Is it okay if I just take a quick cardiovascular history of you?
Yes.
As well as that, I might just do a quick physical assessment of you as well.
Yep.
So just start with, do you have any cardiovascular history?
No.
So you have no issues with your heart before? Any of your vessels before?
No.
No. Have you ever experienced chest pain? No discomfort, tightness in your chest, any of those abnormal sensations in your chest before?
No.
Have you ever experienced any shortness of breath?
No.
Particularly on exertion, when you're getting up, walking around?
No.
No, never before. Okay. Have you ever had any beating your chest, like thumping your chest that you're able to feel it?
No.
In other terms, palpitations. Have you experienced those before?
No.
Have you experienced any abnormal leg pain, any swelling in your legs?
No.
No? Okay. Have you ever experienced any peripheral swelling, say in your hands as well as your feet?
No.
No? Okay. Have you had any fainting episodes before where you've gotten dizzy or lightheaded, particularly when you're standing up?
No.
Or just when you're walking around normally?
No.
No? Have you ever had any sputum, any coughs that have brought up any phlegm that might be red tinted or blood in your phlegm at all?
No.
No, okay. And you've never experienced any leg pain?
No.
No. Just going into your past medical history, so you said before that you've had no issues with your heart before?
Mm-hmm.
No? No previous surgeries on your heart?
No.
No pacemakers or anything like that?
No.
Okay. What about your family history? Have you had any close relatives that have died early from any cardiac related issues?
No.
Do you have any current family members treated for any cardiac issues?
No.
Okay. Are you carrying on any medications?
No.
No medications at all? Anything in particular with your heart?
No.
Do you have any relatives that are on medications for
No.
their heart? No. What about your social history? Do you smoke?
No.
Do you drink alcohol?
Yes.
Have you ever taken any illicit substances, particularly cocaine?
No.
Have you taken any anabolic steroids recently?
No.
No. There's no red flags that are coming up in our history that I've just got off you. Do you mind if I just do a physical assessment?
Go for it.
Fantastic. Just to start, I'm just going to look at the general appearance of my patient. Do I see any exertion, any signs of distress, any discoloration on his skin, any sweating or diaphoresis at all? Just to start with. Do you mind if I just grab your hands? So just looking at the hands, I don't see any peripheral cyanosis at the fingertips. No signs of splinter hemorrhaging. Are you able to put your fingernails like this for me? So no signs of clubbing at all in his fingertips either. Just feeling no abnormal temperature changes between the hands. No skin or changes, no swelling are noted. Just feeling for radial pulses bilaterally. Radial pulses regular and strong. Just working my way up the patient's arms. Do I see any signs of swelling, any scars, any deformities? Any temperature changes in the arms? No. Are you going to turn your neck just to the side there? So just looking for any jugular vein distension on the neck. And the other way around. Just feeling for a carotid pulse. Okay. Now, Liam, are you able to walk? Just look at me, that's it. Are you able to open your mouth for me? And poke your tongue out. Just look at the mucosa of the tongue. Quite moist, he's well hydrated. Open your mouth again for me. Just looking at the general oral health of the mouth. No missing teeth, no signs of infection at all. Okay. Looking at his face, do I see any central cyanosis at all, especially in the lips? None noted. Are you able to pull your eyelids down for me, Liam? Thank you. Just looking at the conjunctiva, no signs of inflammation at all. No signs of xanthelasma underneath the eyelids. Now just working my way down the chest, I'm just looking for any deformities, any swelling, any redness, anything that shows any signs of infection or injury. I don't see any scars from previous surgeries, no signs of an implanted pacemaker. You able to take a nice deep breath for me, Liam? Equal rise and fall of the chest. Yeah, lean forward for me, Liam. Just inspecting the back as well, looking for any scars, deformities. Any sacral edema, there's no pain there when I palpate.
No.
Fantastic. And there's no pain when I palpate on your chest either.
No.
No. Do you mind if I just listen to your lungs there? So I'm just going to do a quick auscultation of the heart valves. Second second intercostal space, left of the sternum. Second intercostal space, right of the sternum. Fifth intercostal space, left of the sternum. And the fourth, fifth intercostal space, just in the mid-clavicular line. No abnormal heart sounds noted. Just working my way into the abdomen again, looking for any scars, deformity, any bulging of the abdomen at all. If I just palpate here lightly, any pain or tenderness there?
No.
No. Abdomen feels soft, there's no rigidity there at all. Just looking for any palpable masses, centre of the abdomen. There's no pain there when I push. Okay. Now Liam, do you mind if I just feel for a quick femoral pulse?
Go for it.
I'll be feeling for the femoral pulses in the patient bilaterally. Now, just working my way down the legs. Do I see any scars, deformities, swelling, any tenderness there in your calves at all?
No.
Have you ever experienced those before?
No.
No. Okay. Just feeling for a popliteal pulse. Present. Just looking at the general appearance of the calves now. I'm working my way down. I don't see any swelling, no skin changes at all, no redness or paleness in the thighs or the calves. Just feeling there's any pain in your calves right now when I push
No.
there? No. Just feeling for anterior tibial pulses, both present. Now finally working my way down to the feet. I'm again looking for any peripheral swelling or edema in the feet. Pushing there. No edema noted. Again looking at any colour changes, any temperature changes in the feet. Nil, and just feeling for pedal pulses in both feet. Both are present. That's it for our physical assessment. Thank you, Liam.